All right, good afternoon, everyone. Thank you so much for joining us here today. My name is Elizabeth, and I'm here with my colleague Julie. We are from IMAC Insurance. We are the insurance broker for the district's health benefits, and this is the 2026 Move to the Health Insurance Fund and Open Enrollment presentation. IMAC Insurance is the district's health insurance broker for medical, prescription, and dental. So if you ever have any questions about your benefits, or if you have a claim matter, please feel free to call or email our office and we will get back to you. We're also very much available to help you out during this transition from the Horizon plan that you currently are in to the Metro Health Insurance Fund plan with Aetna that everyone in the district for medical will be moved into as of July 1st. So the Livingston Public Schools will be transitioning its current medical plan from Horizon to Aetna for medical only through the Metropolitan Health Insurance Fund effective July 1st. The benefits, as we've mentioned in previous meetings and in the communications that you've received, are all guaranteed to be equal to or better than. Due to this change, if you'd like to make a plan change or any other changes, since it's also your open enrollment period, you have until Wednesday, June 10th to do so. There will be no changes to your prescription or your dental benefits. If you are looking to waive your coverage, you would have to complete and submit a waiver form. If you are someone who has a dependent that is enrolled under what's called Dependent 31 or Chapter 375 coverage for medical or prescription, they would have to re-enroll with Aetna. Please reach out to us if that's something that's applicable to you. We do have the form on the IMAC portal, but again, we can walk you through what that process looks like. If you wish to stay in your same plan that you're currently in, your information will be loaded into the Aetna system exactly as it appears on the Horizon system with no action required on your behalf. What that really means is that, as I've spoken to quite a few employees that are either in Direct 15 or in the educator's plan, if that is the plan that you want to stay in, it'll just be moved over electronically to the Aetna portal, so you don't have to take any action. But for those of you that I've spoken to, which have been quite a few of you, if you're looking to move to save some contribution monies, you can go ahead, and I know that a lot of people are considering either the Direct 10 or the Direct 15, moving to the educator's plan, which we are going to touch upon those plan differences momentarily as well. During this open enrollment period and transition, the same 4 plans that are available now are the same 4 that will be available under Aetna. And these are the names that they will be called under Aetna. So for example, your direct access plans will be called the Aetna Choice POS 2 $10 or $15 plan. The educator's plan will be called the Aetna Choice POS 2 Educator's Plan. And the Garden State Health Plan is going to be called the Aetna Whole Health Garden State Health Plan. For those of you that were hired before July 1st of 2020, you will have to go ahead and you can go ahead and elect from any of the plans that are available because it is your hire date that determines the plans that you're eligible for. One of the questions that we've been fielding a lot is, if I'm in direct access 10 or 15 and I move to the educator's plan, can I go back? And the answer is yes. Your date of hire dictates what plan you're eligible to elect from. So for those of you hired before July 1st of 2020, you can pick from any of these 4 plans. For those of you that were hired after July 1st of 2020, you can only elect from the educators or the Garden State Health Plan. Your medical plan election also will dictate your prescription plan election. So if you're in Direct 10 and 15, those 2 plans share the same prescription plan. But if you move to the educators or the Garden State Health Plan, those have a separate and different prescription. Even though it's under Bennett card, it's a different list of covered medication, which again, we do have a slide coming up about that. For any of you under Horizon that have been pre-authorized for a procedure or any service like that, like an MRI, for example, you or your doctor will have to obtain a new pre-authorization from Aetna. Once your ID number is available, you can go ahead and provide that to your provider to get that information, to get that process started. But unfortunately, Horizon cannot transfer over any prior authorizations that are on file to Aetna just because they're 2 separate carriers. For those of you that are considering a plan change, or even if you want to stay in your current plan, we do suggest that you take a look at your doctors to see if they're in the network. Between both the Horizon and the Aetna plan, both carriers share about 96% of the same doctor. So it's very likely that your doctor that's in network under Horizon would very likely be under network under Aetna. We do have these instructions posted on the IMAC portal as well, and I believe they were shared in the communication that Amy put out last week. But again, we do suggest that you do take a look at that just to make sure that your providers are in network. If you're a provider that is currently in with Horizon and you're in the middle of a treatment like cancer or pregnancy, you may be eligible for something called transition of care. Reach out to us. We can walk you through what that process looks like. We also have the transition of care form on the IMAC portal in case that's a situation that's applicable to you, that your doctor would be involved in submitting that on your behalf, if that's the case. All employees will receive new ID cards before the July 1st effective date. It's very important that you make sure that you receive them and that you present them come July 1st. One of the biggest challenges that we see after a group makes a transition is that claims aren't processed correctly because the doctor's office didn't file it with Aetna. They filed it with Horizon because they didn't have your new Aetna plan information. So it's very important that after July 1st, you're presenting that ID card to your provider's office. We are expecting ID cards to be mailed out around June 20th. So that week of June 22nd is when we expect that everyone should have their ID cards. At that point, you should also be able to go on to the Aetna.com website and create a member portal where you can download a digital copy of your ID card as well. I know that we've spoken to a few individuals that are having procedures right after the July 1st transition, and we are keeping a list of who those individuals are because once we also get the ID number, we can also share that with you. So if that's something that's applicable to you, reach out to us. We'll put you on the list to make sure that we give you that ID number so your doctor can begin that pre-authorization process in case you have something happening right after the 1st. But again, very important that you not only look for that ID card and make sure that it has all of your dependent information and that it's accurate with the plan that you're in, and that you present it as of July 1st. For those of you that had any deductible or maximum out-of-pocket monies that you've already accrued up to this point, Horizon is providing us a file to provide to Aetna that will be loaded automatically. So there's no action required on your behalf to provide any explanation of benefits or any other documentation to show that you've met your maximum out-of-pocket or your deductible, as we will receive that from Horizon. It's not going to happen automatically right after July 1st, just because there is a lag in how claims are processed. So we want to make sure that we capture as many claims that you've accrued under the Horizon plan so we can transfer those deductible and carryover maxes to your new Aetna plan. One of the questions that we've been getting a lot over the last few weeks is why is the educators plan and the Garden State Health plan, why are those plans less expensive than the Aetna or the soon to be Aetna POS to the 10 or the 15 plan? And the reason for that is because the 10 and the 15 plan are calculated using a percentage of premium. So as the premium goes up every year, so do your contributions under those two types of plans. But because the educators and the Garden State Health Plan, however, calculated under what's called Chapter 44 or a percentage of your salary, there is a guaranteed savings by moving into either of those plan options, just because they're calculated very differently than your 10 and your 15 plans. And while, as I said, you will have a guarantee of savings, there are plan differences that we are going to be speaking about in this next upcoming slide. So for the New Jersey Educators Health Plan, that plan utilizes the same network of providers in the POS 10 and in the 15 plan. So those three plans utilize the same network of doctors. So anybody who's even now in your Horizon plan, anybody who's in your Direct 10 or 15 is in the educators, and that's the same under Aetna. The Garden State Health Plan, however, does have a different Aetna network, and it only has coverage in the state of New Jersey. So while the Garden State Health Plan is the least expensive contribution plan, it's also the most restrictive plan. I know most of the employees that I've been speaking to are either in 10 or 15 and are looking at the educators plan. We don't see a lot of activity in the Garden State Health Plan because, again, smaller limited network, and also because it only has coverage in the state of New Jersey. As we mentioned, the educators and the Garden State Health Plan are calculated as a percentage of salary rather than premium, which is why there's a guaranteed savings. And there's a lot of contribution stability as well, because unless you have a salary change, your contributions are not changing. One of the questions that we've been getting a lot is, well, I have the educators plan now. Once we move to Aetna, are my contributions going to change? And the answer is no, because in the educators plan under Horizon and also under Aetna, it's calculated the same way for your premiums, for your contributions. So unless, again, you have a change of salary, your contributions are going to remain stable. Under the educators plan or Garden State Health Plan, it is a $10 copay for your primary care. It is a $15 copay for a specialist and $125 emergency room copay, but it would be waived if you're admitted into the hospital. None of the plans also require any referrals. But those two differences there on the bottom of the slide that we have highlighted are really the main differentiators between the Direct 10 and the Direct 15 plan. So if you are someone who goes out of network with a certain degree of frequency, your out-of-pocket costs are going to be higher if you go to out-of-network providers under the educators or the Garden State Health Plan. So looking at your out-of-network utilization is important if you're considering a plan change. Also, because it utilizes a different list of covered medications, even though it's still under Benecard, because it's a smaller list with a mandatory generics requirement, that is also something to look at what medications you and or your family are on to see how the plan would work for you. I know that a lot of you have either called or emailed me with medication lists that you're interested in seeing how they're covered under the educators plan. Keep that coming. We want to go ahead and do that research for you just so you understand how your medications would be covered if you move to the educators plan. But again, it's important to do that due diligence of how do you, how much you go out of network and what medications you're on to see if the educators plan or the Garden State Health Plan would work for you. As we mentioned, the 10, the 15, and the educators plan all use the same network in the state of New Jersey. The Garden State Health Plan uses a different network, which is a smaller network under Aetna. But the 10, the 15, and the educators plan have the same national network. So one of the questions that we've also been getting is, does the educators plan cover me out of state? And the answer is yes, because it has the same national network as 10 and 15, but the Garden State Health Plan, as we've mentioned, only has coverage in the state of New Jersey. Your primary specialist copay would vary depending on the plan, but again, very similar in either that $10 or $15 range. And your annual physical or well visits for children, those are covered at no copay in network. Out of network or deductibles, I should say. None of the plans require an in-network deductible, but you do have your specific out-of-network deductibles applicable depending on the plan that you choose. And again, deductible is the amount of money that you would lay out before a plan begins to pay towards claims. So again, $0 in network and out of network, there are the limits there, whether it's single coverage or family coverage. And out-of-pocket maximum is the most that you would lay out in a calendar year, and you have different limits in and out of network. Again, these limits, like all the other benefits, are being matched line by line as everything is equal to or better than with the transition to Aetna. As we mentioned previously, there are no referrals required. Your labs continue to be the same. So LabCorp and Quest are your in-network labs, and they're covered 100% in-network. Out of network, you are subjected to your applicable deductible and coinsurance. Same thing applies for outpatient surgery, covered at 100% in-network, and the applicable deductible and coinsurance would be applied there. And your emergency room copay, again, depending on the plan that you're in, but would be waived if you're admitted into the hospital. I haven't seen any questions come through the chat, so please feel free to go ahead and post them as we are going through the presentation, and we'll answer them as we're making our way to it, so we don't have a fluster of questions at the end. When you talked about out of network really refers to a doctor that's not contractually obligated with the carrier. So even now, in Horizon, you have doctors that are in network, you have doctors that are out of network. Those doctors that are out of network because they don't participate with any insurance can really bill whatever they want, whereas an in-network doctor can only bill you your copay and that's it. So when you go out of network, it's very challenging to control your costs. And while you do have out-of-network coverages on all of the plans, What we can tell you is that in the educators and in the Garden State Health Plan, that reimbursement for out-of-network doctors is lesser than it is under your 10 and your 15 plan. So again, if you're someone in the 10 or the 15 plan that is considering moving to the educators plan, for example, definitely something to think about based on how much you go out of network. I spoke to someone earlier today who goes out of network every single week and multiple times a week, actually, because they have several family members that go out of network every week to therapists. And what I told him is that you'll definitely have a savings, but it's going to be eaten away by your high utilization out of network. Whereas another individual that I spoke to, they go out of network about 3 or 4 times a year to see a specialist. And again, they are still going to come out ahead savings wise because they are not going with that degree of frequency as the first person that I mentioned. So thinking about how often are you going out of network is important to make that decision. Something else that I wanted to mention is that for those of you that are looking to move from the 10 or the 15 plan to the educators plan, for example, you're at most committing for a year because every year you have open enrollment to go ahead and switch back, again, based on your date of hire. So it's not like if you leave Direct 10 or Direct 15 now that you'll never be able to go back into it. You just have to stay in the educators or the Garden State Health Plan for 12 months, and then next open enrollment, you can make the change to go back. Just to go over out of network in a little bit more detailed, when you go out of network, let's say that provider bills you $100. Aetna will take a look at that claim starting as of July 1st, the same way that Horizon does now. They would take a look at that claim and determine what the usual, customary, and reasonable allowed amount for covered services is. Let's say in this example, they decided that that would be $50. Aetna, in that example, pays 70% in coinsurance, which is the blue box, that $35. You as the member pay $15, which is your 30% in coinsurance. That gets applied towards maximum out of pocket. But that other $50, that's still part of the total amount billed by the doctor, is what is known as balance billing, and that does not get applied towards maximum out of pocket. So it's important to have an understanding of how out of network works. And while this is a hypothetical example, out of network visits are usually higher because you're seeing a specialist for the most part when you're going out of network. You're usually not seeing a general practitioner when you go out of network. So, these bills can be much higher than this example here. So it's important to even have that conversation with a provider and say, could you give me a predetermination of coverage and as far as what you'll accept as payment in full, or what you will be billing me for that service. So those are conversations that you can have ahead of time with your doctor. But again, to better understand out of network, or if this is something that you're contemplating with potentially making a move to the educators plan, reach out to us. We can have that one-on-one like we have been with other members. As far as prescription plan, as I mentioned, that's not changing, but your medical plan does dictate what prescription plan you get. So if you're in Direct Access 10 or the 15, you will be in the same prescription plan that you have now. But if you're someone in the looking to move to the educators plan, however, that is a separate list of covered medications. It's a smaller list that has a mandatory generics requirement. So even if your doctor writes Crestor on the script, rosuvastatin, which is the generic for Crestor, is what's going to be covered. So again, very important to look at your utilization of prescription to see how that would work for you. I've had people that have emailed me their lists with names and dosages of medication, and a lot of people don't even know that they're already on generics. So in those cases, the plan works great because they would pay a $5 copay for generics and they're fine with it. But other individuals that have emailed me on certain medications, we've been able to definitively let them know this isn't covered, or this is the alternative that would be covered. So again, if that's something that's applicable to you, send us an email with those dosages and names of drugs, and we can do that search with Benecard to see how they would be covered for you should you choose to move to the educators plan. So as far as next steps, if you're not making a plan change and you're happy with where you are, you can go ahead you can go ahead and complete you don't have to take any action, excuse me. So no action required if you are staying in the same plan that you currently have right now. But if you are completing an enrollment form, if you are making a plan change, you would have to complete an enrollment form. I understand that you can do it on Frontline, or you would complete a waiver form if you're waiving coverage. We do have the IMAC portal to evaluate how the educators and the Garden State health plans compare. But again, that we have that all on the portal, and there was a comparison that was emailed out as well, I believe, with all the communications. And again, we do have the contribution calculator on the portal as well that you can use to go ahead and figure out what your contributions are, but you do have to have Excel 2013 or later in order to use it. So please feel free to reach out to us if you call us or email us with your salary information, and also whether it's family coverage to adult, single, parent, and child, we can tell you what your contributions are. And again, we highly encourage everyone to use the Aetna DocFind to look up participating providers, especially for those providers that you can't live without. And again, this is also your open enrollment period. You do have until June 10th, and all changes are going to be effective July 1st, and your next open enrollment period would be next year. So that's important. The IMAC benefits portal is imacbenefits.com, and you can go to the website, and the guest key is Livingston Board of Ed, as laid out on the screen. We have the communication, the contribution calculator, the DocFind instructions, and a video of this webinar's recording will also be posted on there. But really, that is your one-stop shopping for everything and anything related to your benefits. This is what the contribution calculator looks like on the portal as well. So again, it is with Excel 2013 or later that you would have to use it. But again, reach out to us. We will run those numbers for you. If you try and open it in Google Sheets, it will not work, unfortunately. And while this is the transition to the health insurance fund and also your open enrollment, we do like to remind everybody that even though this is your time of year to make any changes to your plans or your dependents, life happens outside of open enrollment. So you have 30 days to make any changes to your enrollment and submit your documentation, with the exception of the birth of a newborn, which is 90 days now. So your coverage is retroactive back to the date of the event, so long as you make and submit your change form and your documentations within those deadlines. So if you get married, let's say July 1st, you have until July 31st to go ahead and submit the marriage certificate and a form to add on that new spouse. Again, if you have a newborn dependent, you have 90 days from the date of birth to go ahead and add that dependent. If you don't make these changes within the allotted time here, you would have to wait until open enrollment next year, which happens every spring for an effective July 1st date. We've also been getting a lot of questions about dependents who age out and what their options are. So all of your dependents age out for medical and prescription at the end of the year in which they turn 26. When they age out, they will be automatically offered COBRA. They will also be offered, or they can be eligible, excuse me, for what's called Chapter 375 or Dependent 31. And if you have a special needs dependent child, there is coverage continuation for those overage dependents with disabilities. For those of you that have those overage dependents that are aging out, as long as they meet certain criteria, like they're not married, have no dependent children, live in the state of New Jersey, or go to school outside of the state as a full-time student, and are not eligible for any other coverage or Medicare, they would be able to have the same plan for medical and prescription that you have now at a lower cost than COBRA. You can reach out to us. We can go over those amounts because it is dependent on the plan that you're in. And there is a form that you would have to complete, which we also have on the IMAC benefits portal, but a lesser expensive option than COBRA for sure, as the COBRA is 102% of the single rate of the plan that you're in, whereas Chapter 375 is about 68% or so of that premium. So we also wanted to mention that under the Aetna plan, there is a gym reimbursement fitness benefit, like you have under Horizon. It's the same amount for $20 a month for a minimum of 12 visits a month to the gym, or you can also use it if you exercise at home, as it is all self-reported. We have the form on the IMAC benefits portal as well. With that said, that really brings us to the end of our presentation. I don't see any questions here in the chat. But I highly encourage all of you that have any questions to please feel free to call or email our office. We are talking to people in real time and emailing people back within hours just to make sure that they have answers to the questions that they need to complete their enrollment and make a decision about whether they stay in their current plan or make a plan change. Julie, is there anything else that you'd like to add before we wrap?
No, I think you got everything.
Perfect. Well, I thank everyone for your time today. I hope you have a great evening. And again, feel free to reach out to us. We are very much looking forward to working and helping all of you. Thank you so much.